welcome to this evening's webinar, Building and Leading an Effective Modern Pharmacy Team, an MPA Masterclass. So I'm Gareth Jones, the MPA Director of External and Corporate Affairs, and I'm here to introduce the Masterclass this evening. This is all about building a modern pharmacy team. And I think just by way of introduction, I know people obviously go through a very difficult time. We know the funding situation is incredibly challenging, with community pharmacy underfunded by 40%. But amongst all the challenges we're facing in community pharmacy at the moment, there are a huge number of opportunities and reasons to believe that there is a better future out there for community pharmacy. We've got high public trust, highly skilled healthcare professionals in our pharmacies, the opportunities from independent prescribing arriving, here for many people already, but arriving in a big way over the coming years. Demand for healthcare is increasing. Increasingly, government is looking to community pharmacy to help fill the gaps that are being created. And of course, there are private services opportunities as well. So amongst all the challenges, the reasons to be optimistic about what's out there for community pharmacy, and therefore why it's so important to be building a team that can help you make the most of those opportunities that are likely to come along. Our speaker this evening is Nick Kay, and I'll introduce him in a few minutes. But first, we're going to have a talk from Cencora and from Rosie Tully, who's the Head of Specialist Sales at Cencora. So first of all, this evening, Rosie, it's over to you.
Thanks, Gareth. Hi everybody. My name's Rosie Tully, and I head up the specialist sales at Cencora Alliance Healthcare. I've worked for Cencora for 10 years now and started as an area account manager in the Southwest, where I'm still based. So I'm going to just give you a little sort of introduction into Cencora Alliance Healthcare. I'm sure you're all very familiar with Alliance Healthcare, but also just talk through three of our key specialist sales areas: MWOS, Optitote and Switch. So I'm not going to take up too much of your time, and it will be a great opportunity for just showcase some of the exciting offerings that we have here at Cencora Alliance Healthcare. So on to that first slide, the Cencora Alliance Healthcare. We, as I'm sure you are aware, are a leading provider of pharmaceutical wholesaling and logistics, clinical trial support, and obviously other innovative healthcare solutions. Cencora is a fairly new brand. We've actually been Cencora for a couple of years, but not in any of our marketing material. So you would have seen in the last couple of weeks that step into the Cencora new branding has now taken place. So a lot of our vans are all branded up, our driver uniforms, the head offices, the warehouses, we're all now stepped into the Cencora Alliance Healthcare branding. So that's a really exciting sort of part, and we're really proud to be able to have stepped through into that. So I'm now going to just talk through the three key areas. I'm going to start with MWOS. So MWOS, Northwest Ostomy Supplies, historically is very much part of the Alliance Healthcare brand, and we specialise in the supply of surgical appliances. So we have a registered DAC, and that gives us access to Part 9 of the drug tariff to be able to pass on specific additional remuneration to community pharmacy, which isn't normally accessible. Ultimately, it's there for enhanced profitability, and we do that by ensuring that you can order items in singles, for example, rather than full packs, which take up a huge amount of space on the shelf, as also as locking in that cash flow, that we are providing that next day delivery via our Cencora Alliance Healthcare vans, and we have a really huge range, the biggest in the market of 12,500 lines, which definitely keeps the warehouse pretty busy in keeping that all stocked up. We have a streamlined process in regards to ordering. It's nice and easy to order because you can do that on single sign-on via your Cencora Alliance Healthcare portal, and there is a separate MWOS digital platform as well, so be able to order directly from there. So I'm now going to move on to Optitote, which is our newest product, if you like, within Cencora Alliance Healthcare. I could talk to you for hours on Optitote, but don't panic, I'm not going to. I'm very passionate about it. I'm really excited to have been part of the team that have developed the product. So we launched about a year ago now, and Optitote, just to sort of explain what it is a semi-automated repeat dispensing solution. And it's ultimately utilizing barcode scanning technology to enable you to, instead of having that tote delivered by your wholesaler, the pharmacy team then unpacking those products onto the shelf and then going again and picking those same products, touching that same pack about 4 or 5 times. Instead, you get a tote delivered with everything that you need for that batch of patients in one tote, so that it's not hub and spoke. They're not bagged or pre-approved in any way, but they're just, the packs are ready to literally take out straight from the tote, scan through the Optitote system and into patient baskets, ready to pack down. The pharmacist would do an accuracy and clinical check up front, and that's the only time that the pharmacist is then involved in that dispense. And ultimately, that is releasing a huge amount of value into that pharmacy by giving the pharmacist the time to be able to focus on services and driving revenue from additional services that could be private that you've not even considered before because you've not had the time and the capacity to even have a look at that. Having had my own business before, in a very eclectic career, I know that having headspace as a small business owner is really key to be able to strategize, to be able to see what's going on in the market, and ultimately this kit gives that time back to the pharmacist, to the business owner, which is really key. Because it uses barcode technology, it's really safe. And we have yet to have any problems at all in regards to barcode recognition, which is fantastic. And it just eliminates your near misses. It's simple in regards that it's just really intuitive to use. It's a really nice practical piece of software. And caring, I guess that's kind of, how would you associate caring with a product, right? It sounds a little bit sort of strange, but we have seen a huge sort of shift in the atmosphere, if you like, in a community pharmacy. Sometimes they can be incredibly busy, very high pressured, a lot of noise from patients tracing prescriptions. With a system that supports you doing that next day, the patients are obviously really a lot happier with the service because it's nice and quick, and that takes the noise down and gives the team a bit of space and general, real kind of camaraderie, if you like, happens because everybody is so much happier in the workplace. So that has been quite a surprise to us as we've seen that roll out across our sites. So yeah, as you can tell, really passionate about Optitote. So I'd love to talk to anybody that would want to learn more. We'd be delighted to pick up on that. And finally, let's move to Switch. So Switch is the Cencora Alliance Healthcare order management system. I think we're right up there with all the other order management systems in the market. They're all pretty brilliant, but Switch really does provide a fantastic purchasing and stock managing solution. It integrates directly with the PMR and provides you the software to be able to do that product level ordering control. So you can set custom buying rules that are applicable and tailored to your business. You can utilize a warehouse feature, which is great if you have your bulk ordering or self-supply. You could also, if you have more than one pharmacy, look at doing inter-branch stock transfers. So it's got the software to be able to support with that. Ultimately, it's scanning the market based on the suppliers that you put into their cascade to find the products that you want and need. So whether that be based on price or availability or next day or next afternoon delivery, it will find what you want. And it gives you access to a full reporting suite for procurement visibility and a little bit of data interrogation as well, if that's what you really want to do with your purchasing. So yeah, again, another great product. We partner with Data Plus. So I don't know if any of you are familiar with the order management system Data Plus, but they essentially run the system for us. It does mean that although it is a wholesaler-owned order management system, we are very much distanced, if you like, from that pricing, because I know it may feel like, obviously you've got competitor pricing on as well. It's very agnostic. It sits with Data Plus to be able to run everything in the background to give you confidence that it's an agnostic site. So we've got a little feedback scan barcode on there. If I'm sure there are probably some Switch users on the site, or if you'd like to give any feedback, we'd obviously be delighted. So please scan the barcode and do a little form for us. We'd really appreciate that. And I guess that's kind of everything. I've whistled through. So thank you so much, because I appreciate your time is hugely precious. And I know a lot of you will be, like me, wanting to watch Traitors later. So I don't want to take up too much of our time. And I'll pass back to Gareth and Nick. Thank you so much.
Great. Many thanks, Rosie. I'd just like to let everybody know there is a Q&A box. So if you have questions at any point this evening, just put it in there and we will come back to questions a little later on. So now I'm really pleased to introduce Nick Kay. Many people know Nick is the former chair of the MPA, has operated pharmacies in Sheffield, Cornwall, the Isle of Man, been highly visible, represented community pharmacy in the media, and most importantly, I think for this evening, an active IP and an innovative practitioner. So over to Nick to talk about getting your team ready to take advantage of the 10-year plan for health.
Yeah, thank you, Gareth, and thanks for everyone for giving up some time this evening. And I thank you, Rosie, for your presentation. And in the green room, we were talking about the difference between a proper cream tea, as Rosie's from Devon and I'm from Cornwall, but we'll leave that maybe for Q&A. So again, thank you all for giving up some time to this evening. And this title of this webinar is obviously building new effective teams and leading those teams. And one of the things that really need to explore is why, before we get to the how. Why do we need this? I've been practicing since 1998. How does and why do we need those effective teams more now than ever? Because fundamental change is coming. The next slide, please, Helen. Thank you. So the 10-year plan, we've all heard about it. We've all heard about this Brave New World, the 10-year plan. So what does it mean, and what is it going to mean for us in community pharmacy? I'm sure you're aware, but the 10-year plan really concentrates across 3 pillars. Those 3 pillars of being, care closer to home, not in secondary care or in hospitals. Well, guess what? That's what community pharmacy does every day. It concentrates on a digital offering rather than an analog offering. And lots of our businesses are in that place to be able to help and deliver that. But also, I think crucially, we're also there in pharmacy to catch those people that do have digital poverty, because we are there giving care closer to the communities we serve. And also prevention rather than illness. And again, we all know the space with which community pharmacy inhabits as far as public health is concerned, and giving great prevention advice. Next slide, Helen, thanks. Okay, so what's that going to mean for us? What's this direction of travel actually going to feel like? So again, the slide says there's not much detail, and that is true. But community pharmacy is mentioned, and is mentioned specifically in the 10-year plan, and talks about over the next 5 years as transitioning from focusing largely on dispensing of medicines to becoming integrated health and neighbourhood services, offering more clinical services. Well, what does that actually mean? Well, up until tomorrow, when I step down, I'm still a non-exec director of an integrated care board in Cornwall. And I can tell you that in Cornwall, they've decided to put into integrated neighbourhood teams. They've moved money from and across from secondary care to local neighbourhoods. And that's going to be £6 million this year, £12 million the year after, and £18 million the year after that. So what you're going to be getting is almost hyper-localized commissioning, which can actually be really challenging when you look at how you would commission and how services would be delivered. But actually, for those of us in community pharmacies that are embedded in our communities, this could also be a great opportunity. The trial sites, of which Cornwall is one, means that for an integrated neighbourhood team, for something that's commissioned, it has to look at all of its community assets. So GPs, pharmacy, voluntary sector, dentistry, and optometry. So this is going to have real world funding consequence. And again, as Gareth said, we know how challenging the funding is in England, especially. This can actually help make our businesses more resilient if we're ready to take advantage of that. Thank you, Helen. Okay. Another thing which is in here, which I think is really important, and as Gareth said, I was I've been an independent prescriber for I think 7, 8 years. At one point, working in general practice, I think I was the second highest non-GP prescriber in England at one point, which is again, you can prescribe in general practice, but up until really recently, you couldn't prescribe in community pharmacy in an NHS model. But again, within the 10-year plan, and we know there's nearly 200 Pathfinder sites across England in independent prescribing, right? But it means that it says that we will increase the role and management, long-term conditions, complex medication regimes, treatments for obesity, high blood pressure, and high cholesterol. That's actually in there. And the other thing I think to mention that is, people will say, is this going to happen? Will it happen? Will it not happen? I think we only have to look across to some of our devolved nation colleagues, right? So, fortunately on the MPA, we are across all 4 nations. And, if you look at some of the funding that independent prescribing attaches in those nations, it's something that in England we should be aspiring to. Chatting to my colleague Sihar, in Scotland, and being fortunate enough to be with the Chief Pharmacist of Scotland a couple of weeks ago, we know that individual contractors can get £3,000 a month for having a independent prescriber on site, and then actually depending on if you meet certain criteria of the number of hours and things you can do, another potentially £2,000 as well. And in Wales, speaking to again David, our new NPA board colleague from Wales, they can you can claim time for training up to nearly £300 a quarter. And again, you've got a range from if you do up to 16 to over 32 hours, where you can claim somewhere between £2,100 and £3,600 a month for having access to independent prescribers, as well as a £26 consultation fee. So, when the first slide says that we're going to move from dispensing to clinical service, you can actually see models around the UK which England could adopt. We need to be ready to be part of that. We know the dispensing funding system, with margin and with, working on averages, is pretty much broken. And we need to be ready to take advantage of this new world. Thanks, Helen. Okay. One of the other things as well is about prevention, as it said, about things like vaccine and screening cardiovascular and diabetes. We're control freaks in pharmacy, aren't we? We always want to be the last line of defense. That's what we're taught, and that's what we're taught at uni, to be that last line of defense, that place that we can hold that risk and make sure that we absolutely are the safety net for the rest of the system. But there are things that we are going to have to let go of and let other people do. So who in your team currently can vaccinate, right? So, your pharmacist can vaccinate, your pharmacy technician. Lots of us disinvested in pharmacy technicians, unfortunately, over when the funding got really, really tight. But actually, pharmacy technicians are going to become more and more a key part of the workforce, which we'll talk about later. We can get trainee pharmacists to deliver vaccinations. Why not? And as well as actually, it's, you could get healthcare assistants. How does your team look? How does it evolve? Who is going to do these things to make sure that everybody's working at the top of their licenses? Thanks, Helen. Okay, so as we move forward and move through these things, moving from dispensing and into services, how are we going to create that capacity? Could you be away from dispensing for half an hour, 40 minutes? Is that something that you could do? We know that long-term condition management, minor ailments, all of the things that are on this slide absolutely will take us time to do, will take us time to deliver, will mean that we actually have to step away, I think, from some of that dispensing process. We heard Rosie talk about, Optito as one solution, right? And which involves, very little clinical impact. We know there's PMR systems out there using AI to do that type of stuff. Personally, in my business today, not only have been using pharmacy technicians and a checking technician, I think today I've seen about 15 weight loss patients, administered 10 private COVID vaccines. Also, being involved with the clinical checking of care homes. It's how we add additional resilience to our business. And are we ready to actually take advantage of that, both from an NHS point of view and potentially from a private point of view? Thanks, Helen. So where are those opportunities? Where are they now, and where are they coming from? We've been talking again for the 10-year plan. So some of the things that are being muted out there, the independent prescribing. As we've already said, we've got Pathfinder sites, but what's that going to look like as things move across? Is that going to be pharmacy first? Is that going to be increased contraception? What is that going to actually be? We were looking at an idea across Cornwall about medicines optimization at place. Why would you need to do medicines optimization within a GP practice? You could absolutely do medicines optimization within a community pharmacy setting with the right access to the right software. You could make people formulary compliant. You could share in some of the value that could be saved from potentially wastage within there. And again, what does private services look like? Where are those additional opportunities? Again, lots of people on this call will already be delivering those and delivering those really, really well. As I said in one of my businesses today, not only have we been doing weight loss, vaccination, travel vaccines. I've been sucking earwax out of somebody's ears, and also just signed up to be able to map some moles, which again is fascinating, right? And it's the way in which we drive income through. Again, I don't mind sharing that. Again, one of the businesses I'm in today, from a financial point of view, I think we did about £40,000 worth of NHS income and £120,000 worth of private income in the last month. It's about making sure that our businesses are more resilient. And again, when you talk to people in the NHS, one of their main issues is around how is the NHS potentially going to be able to fund our time? Are we going to be actually too embedded in private services to actually take advantage of some of those opportunities? It's where NHS England really does need to think about commissioning us in a different way. And are we ready for that? And are we ready for that journey? And are we ready for our teams to be empowering us to deliver that journey? Thanks, Helen. Okay, so how is it going to work for you? If I throw that challenge out to you, you could say to me, well, that's all well and good, Nick. You've started doing this, but how are we going to do this? What's going to do? How are you going to do? What's the next thing you're going to do until next week? How are you going to actually change that skill mix? Who's going to do it? How are you going to do it? And how are you going to invest in that to make sure that those people are driving different income? So again, the way in which we look at the lines that are on here within our business, I'm sure, is the way in which you look at it. So as an independent prescriber, while I'm waiting for the NHS to catch up, how am I going to drive revenue? How am I going to drive care? How am I going to make sure that care is delivered in the right way? We've got pharmacists. We're using our pharmacy site for training of independent prescribers. We're seen as a clinical site, a clinical place to deliver care. So as a DPP, I've got somebody from University College London training with me. How are we going to explore those opportunities, both to not only drive our businesses forward, to build our teams, to retain our teams, to show them what that future could look like? Pharmacy technicians, I've got eyes. Sorry, Helen, can you go back one? Thanks. Pharmacy technicians, they are, again, we've started to reinvest in pharmacy technicians. We've got them, doing Timper Health. We've got them vaccinating, as well as being accuracy checkers. That's key to us. I couldn't function without them. I couldn't drive that additional revenue into the business without our team members, and counter assistance, right? So again, in Cornwall, we've got systems and things commissioned via public health, where counter assistance can absolutely be the key for driving some of those services. I never underestimate our counter assistance. I'm pleased or sad to admit that I'm 50 in a month's time, and up until really recently, a lady was working with a community pharmacy that I used to own in Newquay, who held me when I was 2 days old, and she retired, I think, about 3 months ago. So this is somebody where our counter assistants are absolutely key for wanting to be able to sort of explain to people the value of some of the services that we provide. How many people have, do you get coming in and go, oh, I didn't know you did that, and our counter assistants are absolutely key to selling that part of our business, in, use the word lightly, selling, upskilling people in making sure they know what's around. And what about other healthcare professionals in your business? How many of you might have physios or, nursing staff working under PGDs for vaccination. We are going to become, if you look at integrated neighbourhood teams, a true place for delivering clinical service. What that means for us, for our regulation, for GPHC is a real challenge, right? But I think we're going to end up being more and more a clinical place to deliver care. Thank you, Helen. Next slide. And if you think these changes aren't happening, they absolutely are. These changes are happening now, and they are happening rapidly. Supervision is changing. I can now say that I was one of those shadowy people in those shadowy rooms talking about some of the changes to supervision, right? And you're not going to get the benefits for supervision will afford you, and the changes that of supervision will afford you, unless you have pharmacy technicians, in my view. I think this is going to be something that will be key to unlocking some of our potential to deliver additional service. And when you're delivering additional service, you really are delivering additional income, stability, and drive to that business. Again, there are guidance that's going to be coming out and that will be coming across all countries within the UK. But changes to supervision are a fundamental change. And that, coupled with every pharmacist now coming out as an independent prescriber, we're going to have 3,400 new pharmacists as prescribers starting in August, and every August from now. So how are we going to make sure that our team are going to support both of those changes to allow people to work at the top of their license, keep your business resilient, but also wanting to make sure that we don't lose people from our sector, which is the best pharmacy sector to work in. And I say that as my brother is the chief pharmacist of a hospital, and I tell him regularly. Thank you, Helen. Next slide. So it's not only about the team. I thought it was really interesting. Rosie talked about Optitote as a helping in well-being, and we have a robot on site. We call our robot Roger, which is exciting. We feel he has his own personality, and today he was being a little bit grumpy and was making me climb to the top of a shelf to pick up a box that was stuck. But actually, automation and efficiency is something that we need to embrace. I don't want people to think that I'm devaluing in any way the dispensing process. It's absolutely key and critical to what we do. But I fundamentally believe that pharmacists need to be involved in the clinical oversight of that process, and less actually doing that process. I think our clinical intervention in the dispensing process, like I say, is critical, but we need to release ourselves from the day-to-day process of it. And again, having had businesses where I used to do 26,000 items a month with myself and 2 other pharmacy technicians that were checking, I know how much that it can actually sort of take up all of your world. And again, we've got to be honest with ourselves, right? Dispensing isn't going to drive the income that it once did to make our businesses sustainable. I never thought I would be in board meetings where people are going, oh no, the pharmacy down the road has reduced its hours. I don't want those extra items. It's going to cripple me. So anything that we can do to make this process more efficient, I think is really, really, really important. Thanks, Helen. So we're going to need to be creative, right? We're going to need to think about how we're going to work differently, right? It's going to be about what we can do differently. So I hope I've sold you on the why. Why now is fundamentally different. Why now is really, really crucial. Changes in supervision, changes in NHS commissioning, changes in people. We know the MPA knows that people want to have more clinical services from you. They trust you. You're part of their community. It's really crucial that we are there to step into the space that they want. So how are you going to actually create that team? How are you going to become that person that helps lead a team? And again, I feel a little bit like teaching, experts, teaching grandma to suck eggs, as it were. But I try and apply some principles which are the same for me, irrelevant to which team I'm leading. So again, whether you're privileged enough to be the chair of the National Pharmacy Association, whether you're leading your team of people in your, the 10 people in your community pharmacy business, whether you're trying to lead an LPC or, leading a panel of consultants on an integrated care board, I think there's a way in which you sort of absolutely need to take a moment to create some, I always try and start with some safety, right? The team that you're building needs to be safe. They need to be able to challenge you as the leader of that team, to actually make sure that they feel in a safe space to actually be able to bring that challenge, to understand it. Yeah. Next slide, Helen, thanks. And how are you actually going to build the trust? How are you going to make people trust that this is the way forward, that this is the way you're going to go? You have to believe in the mission that you're setting out, the roadmap, the future with which you're driving your team to go down. How are you going to clarify that purpose? How are you going to make sure that actually this is the way in which the business needs to go? This is the way in which it needs to be. And if you buy into this mission, then we'll invest in you and upskill you. You know, how are you going to encourage that community of challenge, and how are you going to value the difference that those team members are going to bring to you? Nobody knows everything, right? I think a really good leader is somebody that can turn, listen, and pivot if required, right? And how are you going to be supportive to your team within that role? So, you know, I think not only is the why we need those teams, but some things for me around the how is that safety, building trust. How are you going to clarify your purpose? How are you going to value the difference that your team members bring to you, and support them in the way forward? And they'll support you and get the best out of you, right? Next slide, Helen. We also have some really great stuff from the NPA. So the NPA, as you know, has great clinical advice. We have this Jasmine's team in the support line as well, which are absolutely fantastic. We have learning and development, and Katie is around from learning and development if we've got specific learning and development queries a little bit later. And also some stuff around Pharmacy First, and it says about market research on there. So the market research is absolutely fantastic. It is something that, you know, the NPA is commissioned. Maybe Gareth may say a little bit about that, and it shows that people do want us to deliver the clinical services. They do want us to be part of their journey, and you'll be really interested to decide what sort of services people want from you. And future pharmacies. Katie, you came off screen. Maybe come back on screen to talk about this briefly. But future pharmacy was something that I started passionately when I was chairing the NPA, and still was chairing the working group. And this is really a way in which we can properly enable that change management for you guys to actually help deliver on the world real change, so that you can start to build your team. Katie, did you want to say anything else to that, or have you got the link on there?
Yeah, I've got the link.
Okay. I've lost you a little bit there, Katie, but the Future Pharmacies group there, if you do follow the link on there, some of the resources and some of the stuff that's there is absolutely fantastic. I would encourage you to have a look at it. I would encourage you to take advantage of it. You know, NPA colleagues have worked really hard to create you some great solutions there for leading and changing your team and building them to be really effective. So yeah, thank you. I think that moves towards the end of the presentation for this evening. Gareth, I think we've got plenty of time for Q&A, even to get you through to Traitors, right?
Indeed. So we've got, I see Rosie, thank you for answering the question that came in earlier about Optitope. So that's gone straight into the Q&A. Nick, we've got a question here for you from Tajinder. Surely it's fanciful to think that DOH will pay us a fair amount to have an IP when all pharmacists when the IP posts are in place in 2026.
No. So that's a great challenge, right? As part of my role as MPA chair, one of my things was, leading us into unfanciful ways of getting funding out of the department, right, Gareth? I even got you in a battle bus, unfortunately. So, again, I think some of the actions that we took before, I think, helped get the 19% rise we all got last time. Do I think it's fanciful that they will pay us for IPs? Do you know what? I actually don't. And the reason I don't for that is I was doing a presentation that was somewhere similar to this from an LPC in Devon, Rosie. There you go, with jam and cream the wrong way round, but still in Devon. And what there was senior NHS leaders within that place. And one of the things they left me with, which was really interesting, was that they said our biggest worry when I was doing some talk about private services was that actually they wouldn't be able to fund our time because they needed to buy our clinical time. And if they were actually creating an IP service, then there was a recognition that those of us with IP could use it for a different way. Capacity is capacity, right? And actually, if you're not using capacity within an NHS setting, or you don't feel it's economically viable to use it within an NHS setting, you'll use it in a different way. So I think there is a recognition that skill set comes with cost. And I don't think that that's unreasonable to accept. It may come in different ways. So again, if you look at some of the stuff in Scotland and in Wales, some of the things there are around you get funding for training. Wouldn't that be nice to be actually able to get funding for training? Katie, there may be an angle there for us, right? But actually, how does that look and how does that feel when, as the leader and the part of the person leading that team, you get the space to actually be able to do that. So do I think it's fanciful? No. Do I think it's a challenge? Yes. Will we make the case? Absolutely. And support CPE in trying to get that over the line.
I might just add to that, Nick, because I was looking at the funding arrangements for Wales and Scotland earlier on today, and as you mentioned, there's a really good commissioning of pharmacy services in both of those countries, and that both of them are making significant use of IPs. They're paying about £20 per head per patient more. So that's effectively 25% more funding for those countries, the pharmacies in those countries. So they're paying for it. They need to pay for it. We do have that challenge in England, but I think when the health system recognises or looks at the challenge it's got, and all the growing number of people with many diseases in their 70s and 80s, and the challenge of actually managing those in primary care, it is obvious that you make use of the independent prescribers in community pharmacy for people perhaps with hypertension and no other long-term condition, or asthma and no other long-term condition. So I think the argument for doing it is very strong. Clearly in England there's a massive funding challenge across the entire NHS at the moment, so it will, as Nick says, be a real challenge. But fundamentally, it absolutely makes sense to do it. Over time, we would hope that the commissioning decisions follow the logic.
Yeah, no, and Gareth, again, just to build on that as well, right? Because if we're sort of doing that, then that's where the whole premise of this comes from. If the pharmacists are working and delivering clinical service, you need to have solutions in place, whether it's Roger My Robot, whether it's OptiTote, whether it's a pharmacy technician, those things are going to be more and more crucially important. And again, the Pharmacy Futures, which Katie's put the link into, with that transformation to actually that change process, real practical steps that the MPA is producing, whilst L&D can support people on their training journey, I think is key and crucial to it. But fundamentally, we have to believe in the journey, right? We have to believe it's the right thing to do. And that's hard, that's really hard, to, like I say, be in a business where we have, again, not waiting for the NHS to catch up, but having team members that are skilled up to be able to deliver those services are things that are really important. But it's really hard when you're trying to step away from that and create that space. And I think that's, when we started the work with Pharmacy Futures, which Katie's put the link into, some of those things there that comes through, it's much more about the how. If we know the why, then it's the how. What change are you going to do on, somebody said to me, what change are you going to do by next Wednesday, Nick? And actually that's a fair and reasonable challenge, right?
You were talking about both hub and spoke and supervision.
Yeah.
So fundamentally, well, the law for hub and spoke has changed, and actually, as of the end of this month, some people will be doing some independents will be doing hub and spoke. Supervision, the change will come through by the end of next year, and that will mean that you can actually delegate to technicians, and they will have accountability for all the actions they're undertaking. Do you see these, perhaps in a 3-year time frame, either of these things as a big deal over the next 3 years?
That's a great small question, isn't it? That's fantastic. Is that a big deal? So, well, I suppose as I was on the working group for both, right, for the Department of Health. So, I mean, I think if you take them one at a time, I think hub and spoke is something that is people will operationalize in different ways. I think there are chunks of work, which is a really personal view, that you could see moving relatively easily. Like, would you move out anyone that's still doing blister packs or something like that? That seems like it would be a chunk of work which is labor intensive that you could move out. I think the automation works in lots of different ways, doesn't it? We've already seen OptiTote as a solution which is not requiring hub and spoke. You may have on-site automation. I think hub and spoke will be a set of things that people may use. Do I think it's the panacea for increasing massive amount of efficiency and gaining massive amount of time? Personally, I'm yet to be convinced. I think there are solutions out there that are more novel and will add more value. But again, I think it's for people to make those decisions within their own businesses. Supervision, I do think, though, is something that is really important, actually. And I think it's the supervision for me in my head when I try and look at it. And like you say, those legislations will come at the end. A community pharmacy will continue to be a place that delivers clinical care, and you'll only get the best value out of it with a pharmacist in it. Right? That's absolutely true. Do we need to be involved in all parts of the dispensing process once we've done the clinical check? Absolutely not. Is it okay for somebody to give out that medicine that's pre-packed and ready? Absolutely, in my view. So I think that has the chance to have operational efficiency, but also to give pharmacists the permission to not feel so pressured to have the consultation room, not door half open, but the ear half there waiting for a knock on the door, because there are things that you have to do that no one else in the business can. So I do think that those things supervision could have a fundamental change in capacity.
Great, thank you. We've got a question from Vicky. Could the MPA offer recruitment support? It's so difficult to recruit technicians.
So I think it is something we should. Could we offer recruitment support? I think that's a really fair challenge from Vicky. I love Vicky's questions; they're great. Her pharmacy is amazing. If Vicky can't recruit them, then no one can, right? But what I would say is that I think there's something about, rather than recruitment, I think it's something about making sure that we can give you the solution to make your business a place a pharmacy technician wants to work. I mean, that would be my real passion for it. Whether or not that's, like I say, the solutions involved from other people, whether that's the solution of, what does your pharmacy technician role look like within your business, whether it's getting them to map my mole, whether that's getting them to, deliver vaccination, whether that's getting them to be involved in supervision, whether that's getting them to be involved in Timber Health. I think direct recruitment may be a challenge, but I think making our businesses a clinical environment, which is a great place to be, is a challenge, right? But I think that's what we should aim to do. I always say to my team, I never expect them to come in going, woohoo, I've got to go to work today, but I don't want them to come in going, oh no, I've got to go to work today. I know that may not be your experience, Gareth, when you've been helping us look after the MPA board, but that is one of the things that, you want to get out of your team, right? That wellness thing that Rosie talked about, that care, that value is something that you shouldn't underestimate. I've heard pharmacy leaders before saying, work should be fun. And community pharmacy over the last 4 or 5 years, although we work with amazing teams, hasn't been as much fun. Actually, Gareth, if it's okay, Rosie, I'm really keen to understand what that care part felt like to your team members when you were doing it. Because if you're building a team, you're leading a team, and you're running an effective team, surely that's a key part of it, right?
Yeah, absolutely. I think it was quite a surprise to us to actually see that as a benefit. It wasn't something that we ticked off when we were building the product. So it was really interesting, to sometimes as a supplier, when you go into pharmacy, you can see the stress level. You can see you can't have eye contact with any of the dispensers because they really are so busy, and you feel like you want to help, but obviously you can't. And sometimes you can help by giving people space and perhaps not talking to them about something relevant at that time. But this is a product that we've seen the change for ourselves. It's been absolutely amazing, and to have pharmacy owners say, "Wow," almost give me a hug when they see me. This has made such a big difference to our pharmacy team. And you go in the next time after they've had the training, and it's a huge change curve to go through, because you're asking, like you said, this is the core part of community pharmacy, is that dispense. And I think it's a completely sort of right. Okay, now pass it to a computer to help barcode recognition. It is automated. It is very process driven, but it does enable the team to step back from that very time consuming process, and that space to be able to focus, like you were saying, on those other driving revenue for the business. So yeah, it's been great to then go back in and to have eye contact. It's little things like eye contact and smiles, and even somebody just having a cup of tea because they've actually got time to make a cup of tea, which is great to see, because it just creates a happier team. We're not seeing the churn of staff as well, so perhaps that staff retention, which is really key, and encouraging people to come into the industry as well. It's products like these that support that dispensing process, that actually help with well-being, and it's a huge part of, I think, everybody's should have fun at work, right? We spend, what you guys in community pharmacy, maybe 90% of your time working. So it's really important to be able to have a really great working environment, and I'm really proud that we provided a product that can support that.
Yeah, somebody was actually telling me today that we spend 80,000 hours of our lives in work. So yes.
Okay, great. Thanks for that, Gareth.
It's quite important. And I think that's the average. I mean, I think probably in community pharmacy it's higher because
I would imagine so. Yeah.
Hours. I just want to pick up private services a little bit, and I think historically we didn't see huge opportunities in private services in community pharmacy, and then along came weight management, and it's provided a quite significant opportunity for a lot of community pharmacies. Is it a one-off, or can we see more opportunities now for a wide range of private services that provide a reliable and significant income for community pharmacy?
Yeah, thank you. I'll go first and then see what everyone else wants to do. So, Gareth, thanks for throwing me that. As a patient and as a prescriber, right? If I looked at I joke in our MPA presentations, I've got before Mounjaro, halfway through Mounjaro, and now 4.5 stone lighter somewhere near the end of Mounjaro, right? So, I do think it does provide some opportunities for us. It certainly provide opportunities in the businesses that I'm involved with, significant opportunities as well, actually, if it's done right. But it has to be done right, Gareth. It has to be done. We have a separate clinical system. We run ours with independent prescribers, although PGD solutions are really helpful out there. But what it's done for me primarily is it's made me value or understand the value of what I do. And as somebody that's always been embedded within the NHS, right, with care free at the point of delivery, other than collecting a prescription charge, which is, government tax, and we hate it, right? You wouldn't go to an accountant and ask them for free advice, right? You wouldn't go to a solicitor and ask them for free advice. So what a pivot around private service has made me realize is that, I was working with someone today who were with PGD, and we had a lady who was 67 who came in for a UTI, right? So we're NHS first, but actually we can turn around as an independent prescriber and go, actually, I've assessed your risk. You can go back to the doctor and wait, or it's 30 quid, right? And I know that sounds really callous, but they are, if people want to have your clinical time, then there is a cost attached to that. Now, it sometimes feels uncomfortable. It sometimes feels as if you're creating two tiers of health, but in an environment which is exceptionally challenged, I think it's taught me to value my 5 years at uni, my master's in prescribing, and what that actually looks like. So I think as we become braver, I think the opportunity will grow, and I think it will move into other clinical areas. So, for example, today, I have done ear health, antibiotic prescribing, pain relief, weight loss, COVID, travel. I injected a 2-year-old, which was not fun for chickenpox, right? But you are building all of those things into the way in which you do. So, and I think if I reflect on the comment about, is it fanciful for IPs to do that? I think, genuinely, if more and more people embraced a private journey, then the government might be at risk of what happened to the dentists, right? Actually, thanks very much. I don't need an NHS contract. I'd rather not. And I'd never, ever, ever thought I would say that out loud. So I think your question and the challenge is really fair. I think it's certainly opened my eyes to the art of the possible and actually the genuine value with which a community pharmacist has.
Great, thanks, Nick. We've got no questions, so just a last call for questions. If anybody's got one, do you want to put it in now before we conclude? Rosie, Katie, Nick, any final thought that you've got before we finish this evening?
Well, I think from myself, just if you'd like any support from Cencora Alliance Healthcare, if you need to speak to any of your account manager, or if you want to reach out to me directly, then I'd welcome that. So just leave your contact details in the chat, and I'll make sure that somebody picks that up to get back to you.
Thanks. I'm not sure if Katie's got any thoughts, but
I don't know if. Can you hear me this time? Yeah.
We can, yeah.
Yeah, so if there's any support that you need from learning and development or any training courses for those pharmacy technician that you want to recruit into your workplace, then obviously you can find out more about the courses that we offer. We did put the Future Pharmacy Network link there as well. And you may also get some contact. There's a research study going on through the Manchester University, so you may get contact people looking for the kind of training and development that people might need to support the 10-year plan as well. So any support with that would be great as well. Thank you.
So Gareth, if I can give some last thoughts. So, I just think that this is a really key opportunity. I think it's a key moment in time with both supervision changes, the explosion of private services, and also some of the automation things that we've been talking about. I hope I've convinced you on the why, and then the how really is you need to create that, supportive, nurturing environment where challenge isn't a problem. And I cannot implore you enough, the Future Pharmacy link that Katie's put in there will actually give you some genuine tools to help you go on that journey of transformation, which we all know is exceptionally challenging.
Great, thank you. I think we've had a really interesting set of presentations and discussions this evening, and I hope it's given everybody on the webinar something to think about. I think, as I sort of said at the start, actually, despite all the challenges in community pharmacy, I do think there've never been as many potential opportunities as there are at the moment. So thank you to Nick, to Rosie, Katie, and also Sabrina and Helen, who've been running the webinar in the background. Thank you for joining us. And if you get to watch Traitors, I hope you enjoy that. And otherwise, have a good evening. Thank you.